hello, and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy Podcast Studio and are super excited to have Londa Sherwood-Austin on our show today. She is going to be discussing her menopause journey and just menopause in general and some tools that she has to help others to overcome menopause. So, Londa, without further ado, welcome to our show.
Thank you very much. I'm happy to be here. It's so nice to actually be able to have a conversation with you.
Yeah, and that's what this is going to be. We're just going to introduce you and you can share your story and we'll just ask some questions. So go ahead and start with a little bit about your background.
Yeah, well, that's a big question.
That is right. You don't have to
Yeah,
start from birth.
yeah. So I was born. No, I'm I've always been really interested in health and nutrition and all that kind of stuff my whole life, but I never did it for a job. In fact, I just recently said to my husband, if I was 10 years younger, I'd go back to medical school and specialize in menopause. But I feel like it's too much. It's too much time to do that now. At my age, I'm 53, which is pretty young, except when you're looking at maybe going to medical school, and then it's
Yeah.
like, nah, I don't think so. So actually work as a full-time licensed realtor in Eastern Washington. I'm also a professional life and business coach. I've done that for over 21 years. And I specialize in the 3 R's: real estate, restaurants, and retail in my coaching. So grew up in restaurants, love it today, still want to own a restaurant. I still have time. But my as far as my menopause journey, I've got 7 kids, that yes, I had all of them, and no, there's no twins, and yes, I know how that happens. So we've covered all the basic questions that I
Right.
get. Yeah, I have a lot of kids. And when I was in my I think I was probably 36 years old. So I had my last one at 31. And when I was about 36 years old, I started talking to my doctor about my hormones because I felt, I don't know, just off, right? And so I started looking into by my we played around with some things. It was really early in the hormone replacement therapy world. Things were not well refined, and it was kind of that moving from my mom's generation to my generation. So it wasn't very smooth, yet. And so some of the things that I tried, it didn't feel right. It didn't feel good. It was either too much or not enough, which, some of that hasn't changed. It's
Mhm.
always a moving target, right? So, but I was on some kind of hormone replacement therapy for um I don't know, probably 10 or 12 years, which I'm very grateful for now because of recent research that says better that you start earlier for long-term health. So, the big surprise was in 2021 when I found out I had cervical cancer, and that was pretty shocking to discover that, and decided, well, I didn't have any real option except to have a hysterectomy in order to deal with that. The other options just weren't going to give me clear margins, right? So did that. The doctor said, "Hey, no, it's great though. You get to keep your ovaries." And the doctor that did this surgery, my doctor at home, because I was on a kind of a 3-year, in the middle of a 3-year sabbatical. And so I was at my home in Florida when I got this diagnosis, and it was winter. I'm almost at my 3-year anniversary. It was winter, and I thought, well, if I have to convalesce, I'd rather do it by the pool in the sunshine than in the cold Pacific Northwest. So that was a no brainer for me. So but I was in contact with my home doctor here in Eastern Washington, and he said, "Yeah, but let's really watch your levels, your hormone levels, because while you do get to keep your ovaries, they may react to this hysterectomy and, kind of go on a rapid decline. And they did, but it took a couple years. So they teased me for a couple of years, and then in this last year, we now have um, uh, blood work proof that they're dead. They're gone. They've given up the ghost, as it were. And so yeah, so that's kind of what got me to here. So these last I felt like I had my hormone replacement therapy kind of figured out, and then these last 3 years, it's been a big jumble all over again of trial and error. And you know, it's menopause is interesting because as a woman, menopause is inevitable. Every woman is going to go through menopause. I don't care who you are. Not every woman will go through pregnancy, right? But every woman will go through menopause. And it's interesting because I'm kind of a nerd. So I go to PubMed and read. This is where published medical articles are, and it's the National Library of Medicine. I'm sure you're familiar with it, but
Mhm.
PubMed.com. And if you do a little search in their search engine for pregnancy, you're going to get about 1.1 million returns of published medical research articles. Right? You do the same search for menopause, you get 96,000.
Wow.
So it's startling to me that not every woman will go through pregnancy, yet we have about 10 times the amount of research and information, et cetera, just by looking at this one resource than we do on menopause, and every woman goes through menopause. So I think this is one reason I'm so interested in the topic. I don't think we talk about it enough. When I had little kids, I had a Facebook group that was for moms, you know, and now the kids are all grown up, and so I have a Facebook group for midlife and menopause because that's just where I am in life, and I don't want to go through it alone. I joke that my mom had the audacity of dying before we got to talk about any of this. So it was 12 years ago, and so we didn't really have a lot of menopause conversations. She went through it when I was like 13. So I just thought she was mean. um
Right. It's true.
and to be fair, she was a little, but now I know she had reasons to be mean,
Mhm.
So menopause is inevitable, but suffering is not. So
That's right.
that's
That's
the
right.
the term that I hold on to. So, in hopes of other women who may be feeling alone, not having to go through it alone, I've got this little Facebook group, and it's on Facebook because that's where women my age are.
Hey, Janet,
So
there's a
that's
lot going on there. I bet you have some questions for Londa.
Well, so I'm really interested of what you did prior to your cancer. I mean, what kind of therapy were you using?
yeah. So uh, honestly, I didn't pay close attention to it. Some form of estrogen, some form of testosterone, some form of progesterone. Couldn't tell you what they were. I really don't know. But I did those three because those are what my blood work showed was lacking. But more
Sure.
importantly than that, how I felt, right? So I think if we had more people in the medical profession who would ask women how they feel rather than looking at numbers on paper, because here's one thing why I'm really, really glad I had those numbers early on, though, while I was still ovulating, still having a monthly cycle, still, relatively young and healthy. I'm glad I had those numbers done because I naturally make about 5 times the amount of estrogen as the average woman. I know that because I had early numbers
Mm.
done before I went through, like at the very, very beginning of perimenopause. Knowing that, I can kind of think, okay, so maybe I need a higher than normal average level now for me to feel good, which is true. It's borne out, So now I do a twice a week estradiol patch. I do once a week testosterone injection that I give myself, and no, I don't enjoy that, but it's effective. And then I take progesterone pill. And after my hysterectomy, the doctor that I saw someplace else, not my regular doctor, took me off progesterone,
Oh.
saying,
Yeah.
"Oh, well, you don't have a uterus, so you
Yeah.
don't need
Yeah.
it anymore." And as it turns out, your brain needs it too. And I do still have a brain.
And so does your bones, and so does your breast tissue.
Yeah,
And
Yeah.
I mean, we're taught in pharmacy school, doctors are taught in medical school that if you don't have a uterus, you don't need progesterone. And it's like, gee, is progesterone that magic hormone that only works in one tissue in the body? I mean, it's ignorance is what
right.
it is.
Well, they're comparing it to Provera.
Yeah.
So
And it's
they're trying to compare it to something that's not even the same. It's so different. So, well, I'm glad you
Right.
I'm glad you didn't get in that trap of not taking it because,
Yeah.
like you
Oh, I
said,
did
your
for a
brain.
while, but it explained why I felt so bad,
yeah, of
Right.
course.
So,
Yeah. Well, I like
yeah.
the idea of what you're saying about getting baseline labs first. And we tell people that whether they're male or female, that they should get labs before they have any problems, because
Yeah.
you do want to know what your optimal level is, not what normal is.
Yeah.
Because these normal levels, a lot of
Mhm.
times, are based on sick people that are going to the doctor all the time. And I don't want to be a normal sick person going to the doctor all the
That's
time.
interesting.
Yeah,
Hmm.
I want to be optimal.
Right. Or
Right.
people that are menopausal, and how does that apply to being optimal?
Yeah, it's like, well,
Right.
your normal level for being menopausal, you're normal for being menopausal. Well, of course, being menopause, you're
Right.
not supposed to make hormones. I
Right.
mean,
Right.
that's why it's
Right.
important to go to a provider that knows what labs to order and how to interpret them appropriately.
Right. So
Man, you got that right.
it's what objective are we trying to achieve? And when you just put it on paper and you have a value, that doesn't always define where we need to go and how to get there. So, the first piece of your puzzle missing was the progesterone. So how did you get that back? Did somebody else talk to you about that? Or you just said, I didn't feel good? Or
Yeah. So, because I was on this kind of 3-year walkabout, I wasn't talking to my home doctor as consistently as I probably needed to be. And so it was just a different doctor in a different city where I was doing my 1-year follow up post hysterectomy and had a conversation. And, she said it with such confidence. Oh, the latest research shows that you don't need progesterone if you don't have a uterus. And I thought, oh, well, okay, that'll save me a little money.
Yeah.
But
right.
I mean, you
And,
don't think like, oh, one less thing to do.
right,
Okay.
right.
Well, then I moved back to Eastern Washington permanently in August of 2023. Got in with my doctor right away to get reestablished, and he said, "Okay, so all right, let's see what we got going on here now. Let's get all caught up to date." And when I told him that, he freaked out. No, no, no. Let's get you back on that immediately. And here's why. So I love my provider because it's the what and the why.
Right.
Also, and this is the kind of provider you need to look for, right? Somebody who tells you the what, the why, and is open to conversation. I probably teach him as much as he teaches me because I'm such a voracious reader and learner, and we have these back and forth discussions all the time. And I have an advantage. He's not just my provider, he's also my friend, he's also my client, my real estate client, so I have a little closer relationship. But most of the conversation happens at my appointments, so you can do that. I think a big problem comes in when you have a provider who's not giving answers. And this is something that I've just discovered talking with so many other women. Well, my doctor told me I'm not in perimenopause. Well, and my question would be, how would they know? Honestly, if you're not getting cooperation from your provider, find a different provider.
And if they say
Mhm.
things like, well, the most recent studies say, or trust the science and don't do your own research, go somewhere else.
Oh,
Seriously,
for
right away.
sure.
Right
For
away. If they
sure.
say, well, just trust the studies, go somewhere else. And by the way, the study that provider that took you off progesterone they're referencing, that's a study
Yep.
from Premarin and Prevera back 70 years ago.
Right. That is
Yeah.
so old. It's not even funny.
It-
It's so sad.
yeah.
It's it's practicing on a premise that somebody tells you this and you just keep going. You just keep saying what they said over and over again without
Right.
any data to really prove what you're saying and not even understanding what you're saying. Because I know today if I talk to several providers, I would get the same answer, but it still doesn't mean it's right.
Right. Exactly. Exactly. And now I know because I did the research and now I got that information and was mortified. I am happy, really happy with what's happening though in the menopause space
Mhm.
because we do have a small group of mostly female providers now that are making it a specialty, and they are demanding more. Right. So I was one of my favorite resources is Dr. Mary Claire Haver, and she has a podcast called The Pause Life. She's written a couple of books. Very a 20 plus year OBGYN double board certified who now closed her practice with babies, now specializes in menopause and has for like the last 3 years. She's got a huge platform, really came into a huge platform on TikTok accidentally just a couple of years ago and is using that platform to gather lots of research and to bring more awareness. And so she shares about other providers that are in this space that are really at the forefront and they're demanding more for us, you know?
I agree. Jen and I have been doing this for 25 years now, and it's changing a lot. And I really like to see the direction it's going. And I agree with you. One of the reasons why is because there's more women that have become into the medical profession and driven that. And,
Yeah.
and then they got the menopause and realized, well, wait a minute. Um, I'm not so crazy, you know?
Oh, seriously, Dr. Haver talks about that very thing. She's when she went to medical school, her entire instruction on menopause was a 1 hour lecture in all of medical school. A 1 hour lecture for something that 50% of the population absolutely is going to go through and will spend what, a third of their life in it. Ugh.
That's the same here. I don't know about Jan's experience, but at my experience at University of Washington Pharmacy School, I had a 1 hour lecture on hormones for women.
Yeah.
1 hour, and it was mostly based on Premarin. You're probably familiar with Premarin, but you
Sure.
got to understand. Yeah, Premarin stands for pregnant mare's urine. It is the most popular estrogen ever prescribed. Um, that's why the studies about not needing progesterone, it's all because of them.
Right.
And pharmacy school and medical schools are funded by those sources.
Right.
That's why that's what they push.
Right.
And they not
Follow the
ever
money trail.
right. Speaking of testosterone for women, my oldest son almost got kicked out of science class. Actually, he did, because he argued with the teacher that that women do have testosterone. And she said, no, they don't. He said, yes, they do. So of course, Janet and I had to prove her wrong and prove my son right. And that's the ignorance
That's a
we have.
testament though to how little we're taught
Exactly.
about our own care.
Yeah. And believe me, Londa, you may have this experience already. It's getting better. But 20 years ago, there were doctors
Mhm.
that didn't think that women made testosterone. I'm serious.
Right.
They went to medical school and they didn't think that women made testosterone. I still fight that regularly about the benefits of testosterone for women, and doctors just look at me like, well, that just sounds crazy. Like bone density, for instance. There's not a better
Right.
drug for building bone density than testosterone. But do you
Right.
think doctors prescribe it for bone density? No.
Well, it's ignorance because even if we just look at the biological definition of a hormone, it's a
Right.
messenger. And we don't just have reproduction as our only goal in life, right? Our only, thing that we do. And so it's really tragic that we throw it, estrogen, progesterone, and testosterone, and there's others, DHEA, all into this
Right.
just this reproductive part, which is super important. I understand that, but it also played a role prior to being able to become pregnant and then
Right.
after.
Exactly.
So
Mhm.
it is ignorance on all levels. And sometimes I feel like it's chosen too, like Shawn's saying, because there's no financial incentive. I mean, the financial incentive for us in menopause is get that hysterectomy done, then get the bladder meshes in, then you get them on whatever. And it's not always the best option for everybody. And it's sad
Right.
because, you know, if we even looked at just on the emotional and relationship level, you have to wonder how many women in our age group probably went through some type of divorce or breakup and having issues with relationship when it could have been different if they
Right.
had the tools to manage what they were facing in their life, because it's a real
Right.
physical thing.
Yeah. Yeah, even just talking about symptoms is so helpful. And
Mhm.
all my girlfriends who are near my age, they have menopause conversations whether they want to or not, because it's just what I talk about, right? And then I find out they really don't have anyone else that's talking to them about these things. But even the symptoms that
Right.
you know, I remember, talking with a medical provider, not the one that I see consistently, but a different one, um, and asking about some of the symptoms I was having and could they be hormone related, and being told absolutely not, and finding out absolutely yes, absolutely yes. My itchy skin. No, nobody talks about how itchy skin and the headaches and the temperature regulation.
Yeah,
Oh my God. If
right.
I Probably my most frustrating symptom is inability to regulate my temperature. I'm freezing cold all the time, but at least I have hot flashes and night sweats. Like, really? Come on.
Yeah, I mean, and there are so many other chronic type diseases, we already kinda hit on them, that are hormone related. Osteoporosis, for instance, that
Mhm.
we prescribe a different drug for. We don't give them hormones, even though that's what they're lacking.
Right.
Um, Urinary incontinence,
Mhm.
vaginal dryness,
Mhm.
urinary tract infections, all things that are related to hormones that we prescribe all these other drugs for, yet, um, the fix is balance the hormones, and not just estrogen. Women don't have just estrogen,
Right.
progesterone, testosterone, all those
Right.
things in the right balance, in the right dose.
Well, and that's an interesting thing that you bring up that should also, bears discussion, is the right dose, the right
Mhm.
delivery system, I mean, because I tried for 3 months estradiol and a once a week injection because, they had gotten some good results with it, better delivery system, as it were. It did not work for me. It was not okay. I got that a big jolt of it when I got the injection, and then it was just too much all at once. I went back to the patches because they work better for me. So really being vocal about
Mhm.
what's working for you, what's not working for you. And as women, we're so uh, I'm just gonna say it. I'll get
Say it.
get right into it. We're so trained by society to just, suck it up and dismiss our symptoms. You just get over it, and we don't listen to our bodies. We don't listen to our symptoms, and we dismiss it and we make excuses for it, and oh, I'm probably tired, or oh, I'm just overstressed, or oh, whatever. When no, actually this isn't working, and it needs a shift. Even I dismissed the estradiol injection. I was like, well, maybe I'm just need a little bit more time. No, it is not working. So I need to change something. And then even when we just about maybe 5 weeks ago changed my dosages. I went up in dosage because I got those lab results that, oof, even on HRT, my numbers were almost zeros. Like, oh, okay, those ovaries have officially said goodbye to this world. And so, we increase the dosage. And he said, okay, I'll see you back and we'll test again in 3 months. I said, nope, we're going to have a conversation in 30 days because I'm not suffering for 3 months if it doesn't work for me.
Right. You don't
One
have to.
thing to remember is our providers work for us.
That's right.
We employ them. My insurance company and myself pay big time to employ them. So the shift for me really was years ago when I realized, oh, they are my employee. I kind of look at it that way, right? Like I'm hiring them to do a job. And so I get a say in it. It really shifted the way that I communicate with my providers.
And speaking of the injection that didn't work for you well,
Mhm.
you know, one of the problems with any kind of injection, just like you were kind of alluding to with your testosterone, is it's an injection. You got to inject yourself. Fortunately, there are other
Yeah.
options, and you found other
Yeah.
options. And the problem with injections is you get this high peak, but then you get a trough later on. So you got high levels, low
Right.
levels, and that's the same with testosterone also. And that's why
Mhm.
I like mine and Janet's favorite delivery of testosterone for women is actually transvaginally. So you apply it to the vaginal tissue. It's absorbed great that way. You do it daily, and not only is it absorbed systemically, but you have good local effects too. Because there is nothing better for vaginal atrophy than topical testosterone cream.
But I
And
think
that's
the
I
biggest
haven't
thing,
tried.
yeah, the biggest thing though is if you don't like it and it's not working,
Yeah.
most people don't use it. And I've said this over and over again. I don't care if the provider prescribes it. It doesn't mean that they're using it, right? It doesn't mean you're going
Oh,
to go home
yeah.
and continue the therapy, because if you're not being heard or you're not liked, I mean, I can't tell you how many women I've counseled that are like, nah, that just didn't work for me. Well, did
Yeah.
you
So
talk to your
Yeah.
doctor? No.
let's do
I'm
another.
just,
But let's
and
do
I'm
another
like,
option. We have other
if
options.
if you can't, like you said, if you can't find that communication with your provider and say, "Hey,
Mhm.
I'm not suffering for 30 more days," it's time to move
Yeah.
on.
Yeah.
It really is. There's too many options. There's too many people doing it even
Mhm,
within the same clinic. Often there are, 8 different
mhm.
providers. Just go to a different one.
Yep.
Yeah. Julie, we have a comment. Do we have a comment or is it spam? It, it's spam. Can we stream the comment? We have a comment. We try to answer all of our questions or comments. Let's see what it is.
Yeah.
Yeah. It is normal range for who and what.
Right.
And what
Yeah.
is the goal that we're trying to achieve? Because my level for somebody might be totally different, even if you are menopausal, because of what goal we have to achieve. And, especially like we talked about bone density and osteoporosis. My ladies that have that, their estrogen levels are going to be higher. Or a diabetic, you want their estrogen levels higher. You want your testosterone levels higher, or your thyroid. So it's subjective also to what the goal is. What are we trying to achieve for this client for their overall health?
And labs are just a
Right.
tool to
Yep,
go along with symptoms and history. And labs, you have to know how to interpret them. It
correct.
depends on, and especially if they're on HRT already, when did they have their last dose? Did they just have their dose? Was it 12 hours ago?
Right.
You have to have a provider that knows about those things, or the labs are
Yeah.
literally worthless. If you don't know how to interpret them, they're worthless. Thank you for
Janet,
that comment, Jennifer.
do you have a bone density test that you recommend?
Yes, I do. I
Great question.
am not a fan of DEX. I am not a fan of putting somebody through a DEX test because it's so old. It's looking at old bone and it's in the history. What you really
Okay.
want is what's called a NICS test, and all it is taking a sample of urine, and it's looking at the amount of bone that's being excreted, excuse me, in the urine that day, that moment. So if I have somebody who we want to see if they've improved, I mean, in in a short period of time with their hormone therapy and their workout, and you can see it turn around, and that's
Mhm.
immediate, and it's not expensive. It's very inexpensive.
Whereas with a
Ah.
DEXA scan, you can't see results
No,
for up to a year. Well, who wants to wait a year to see if their bones got better?
you want to know what's actually physically happening now and reverse it now, not what
Mhm.
happened 2 years or in the past. So the only reason I think that the DEX scan is still there is because insurance companies are paying for it. Yeah. Really? Isn't that
Yeah,
sad?
we see
And
a lot
mixed
of that.
test has been around for a
Yep.
long time.
Interesting. Are you of the school of thought as you age, less cardio, more lifting? I'm just curious.
No, I think it depends on the individual. Now, do I
Okay.
think that we have to be super careful about making sure that we have weight bearing? Absolutely. So, Sean and I are in, groups of people that cycle their bikes a lot, and a lot of those
Mhm.
people forget that they need to have that core and that balance. But it doesn't have to be huge weightlifting, it can be just resistance, right?
Right.
Just body
Yeah.
weight.
So the other thing with it is also your balance because as we get through menopause and we get past it, balance for people is a real thing. So core
Right.
exercises force you to be able to hold on to that and you have to work at it. So yes, weight bearing exercises are important. Now how that looks is really different for everybody. I mean, weight bearing is walking, it's not swimming and it's not cycling. It could be, resistance. It could be in the gym, lifting weights. But the whole thing is it has to be balanced, right? Because um, the worst thing that happens to us as we age that's detrimental, especially when we get into our 80s and 90s, if we fall and break a bone, especially our hip, it's game over.
Yeah. Yeah.
So we need to
It's
be
game over.
strong, and we need to have
Right.
good balance
So,
and
Right.
mobility. That's what keeps us healthy.
but I'm not
Mhm.
opposed to cardiac at all because we have always been that way on this earth. We've always had to have endurance. I mean, my father was a
Mhm.
rancher. He didn't run all the time. I mean, short bursts or whatever. But most of us, if we were in hunting, gathering, or if we were like, like my father, you had to endure the work that you did for the whole day, right?
Right.
You had to, and we sit in offices and we don't move our body like we used to. So I'm not this person that says, oh, your cardiac doesn't matter because it does. It still does. Endurance is
Mhm.
still important. So
Right.
I don't throw I'm not of the school that you throw it all out the door. You just have to make adjustments to where you are and what's appropriate for you. So, when I was 20 years old, I didn't have balance issues. Now I'm in my 50s. I have to be careful and make sure that I keep my balance.
Yeah. Yeah. You start favoring these kind of things.
Yeah, right. And
You
that's why
know?
you just have to make yourself do things that might be uncomfortable.
Right.
So
Yeah.
a lot of one-legged exercises.
Right.
Doesn't have to be heavy weights. We're a big believer in strength training, but we're also a big believer in cardio, and that you can define that many different
Right.
ways. You don't have to go ride your bike for 5 hours at a time, like Janet and
Right.
I sometimes do. But let's remember that our most important muscle in our body is our heart, and not that you can't
Right.
get a good workout, a good cardio workout with appropriate strength training, because you can
Mhm.
if you go hard enough, but you just got to realize that.
Right. So I think it's a balance. I mean, I'm not against it and I'm not opposed. I have um, a gal who's about a year older than me that graduated from the same school that runs Boston marathons, and you have to qualify to be in it. And she's
Oof.
always been an amazing runner. So good for Allison. It's something she enjoys, and she's still very active in doing it. I mean, I think that that's wonderful.
Mhm.
I could, I don't really have that desire, but I still think that there is on some level something that you not only get not just physically, but there's something mental too to the healthiness of
Yeah.
exercise that women sell short. We sell ourselves short. And there's nothing more when, Sean and I talk about this a lot. You solve a lot of issues when you're exercising, right? Things don't become so
Mhm.
important. You think about it in a different light. Your
Right.
brain and all those neurotransmitters start changing. So
Mhm.
exercise is super important to your mental and emotional health.
And
And you
let's remember
said
this, Londa.
something.
Yeah, go
Sorry,
ahead.
Sean.
No, well, let's
Oh,
remember this, is that something is always better than nothing.
Yeah,
That's what we
yeah.
tell, because let's face it, most Americans are so sedentary. Just do something. Start with
Yeah.
something.
right.
So go ahead,
Yeah.
Londa.
And well, Janet, you brought up a good point that your friend who runs, she loves it,
Right.
right? And I think sometimes we forget to play.
Yep.
Yeah.
I live right on the Columbia River, and I walk right out my back door, and I'm on the bike path there, the walking path, and it's lovely. And we often, my husband and I, will go walk at the river. But one of my favorite things to do is to go down and hop. There's these huge rocks that probably 4 feet across and 4 feet off the ground, lines of them. And my one of my favorite things to do is hop the rocks. And I
Mhm.
have to think that kind of thing is probably really good for me. I do it because it makes me feel like a kid and it brings
Mhm.
me
Yeah.
joy. But I would think, probably for balance and all that,
It's
it's
Absolutely.
probably
strength,
good too.
balance, strength, mobility right there.
Yep.
Those are,
Yeah.
and we talk about functional movements a lot because let's face it. I mean, we all want to be functional. We don't want to be in a walker. We
Hmm.
don't want to be in a wheelchair. So to do
Yeah.
things like jumping on rocks, those are functional movements. Because if you can jump on
Yeah.
rocks, then you can get up off the couch and walk, right?
Right. Yeah, for
So
sure.
my guess is you live in Richland.
Yeah.
So Janet and I have ridden that bike path hundreds of times. So we've probably ridden by your
You
house.
probably have, yeah.
Probably. Yep.
That's a
Yep.
nice, very nice bike path.
I love it so
Yeah,
much.
yeah,
We walk it pretty consistently. My only problem with it is there aren't any hills, and I like to have a little
yeah. It's
elevation,
obviously it's by the river, so it's very flat, right?
Yeah, yeah, yeah,
Yeah,
yeah.
and I
So
will
there
say that during the summer it gets busy.
oh, it does.
I mean, really
Yeah,
busy.
that's the give and take, right? Like the the great part about it is that you're right there, but the really terrible part about it is everyone else is
Everyone's right
right
there,
there.
right?
But I love it. A lot of motivation for me is staying active with the grandkids, and I want to be able to play with them and run with them, and you don't think about we don't talk about it.
Right.
We don't talk about those things when you're young, or maybe when I was young, people did talk about it and I wasn't listening. I certainly don't remember any of those kind of conversations. I think the conversation of women's health is shuffling to younger women. My daughters, my
Mhm.
oldest daughter's in her 30s, and we're having these conversations, and she's talking about getting those baseline numbers now before she starts into even perimenopause. And so the more we talk about it, I think the better off we are. But there's the financial piece of it too, which we haven't touched on yet. But healthcare is a financial privilege in America, and that's frustrating to me. The I'm about to be I'm shopping for healthcare right now because my husband changed companies, and the new company offers him healthcare but not me. So I've got to find private healthcare or something like that. It's crazy expensive, and uh, you know, lab tests are expensive, and supplements are expensive, and prescription medications expensive. And I just get frustrated at the system, I guess.
Well,
You
I mean,
know?
those are great questions. And being on my podcast, you'll get a copy of my book also. In fact, instead of sending you an electronic copy, I'll send
Awesome.
you a signed copy. And
Ah, cool.
it's called Sickened: How the Government Ruined Healthcare and How to Fix It. Will you stream that banner on there, Julie? There should be a banner under banners, just with my book information. Um, and and I understand what you're saying, and I will also say this is that healthcare can be inexpensive if you know how to shop for it. That's the key. First of all, you talked about it, shopping. Don't
Hmm.
just trust your employer for your healthcare. In fact, never trust your employer for your healthcare. Never trust the government for your healthcare. It's your own
Right.
healthcare. And ultimately, one of the reasons we started this podcast is because we want to educate and empower individuals to take charge of their own health. That also means financially. And let me give you a good example. And you'll read about this in my book. Health insurance, for instance. Jan and I got burnt out on health insurance 10 years ago or so when we were paying $1,500 a month from something we never used. Okay. So we found something different. We have a health sharing ministry. Janet and I now, we pay $180 a month for our health care. And we get to choose our own doctor. We get to choose what things are covered. Very affordable, $180 a month for 2 people. Very, very affordable. But you got to know those things. That's one of the reasons we have this podcast. One of the reasons I wrote a book, to educate people that $2,000 a month insurance is not the only option. You can do something
Right.
different.
Yeah.
And another thing is too, search out, one of the things that makes healthcare expensive is insurance. So insurance alone makes healthcare more expensive. So if your provider is taking insurance, they're billing higher prices. Those are just facts. I'm not beating up on anybody that does that. Those are just facts. They have to hire extra people to do those bills. Over 50% of their staff is due to collection of insurance. So for instance, you can go to a direct primary care doctor and you can have unlimited visits, 24 hours, 24/7 hour access to a doctor. You know how much money it is, Londa? I want you to guess.
I don't know. I mean, you know, the private plans that I'm looking at are between $600 and $800 a month. So I'll just guess that.
$75 a month. You can have unlimited access to a doctor 24/7. I'm not kidding you. They do not bill any.
Beautiful.
Yeah, they do not bill any insurance. It's a monthly subscription. They can do FaceTime consults. They can do texting. It's incredible. But people don't know those things. We're so stuck in the traditional health insurance model that that's all people
Yeah,
know. So then they
that's
think it's
true.
expensive. Well, health insurance is what makes things expensive, honestly. So
hmm
that's a topic for a whole nother podcast.
Right. But where can people get that information? Through your book, or
Absolutely. They
do
can
you
get it
have
through my
it
book,
somewhere?
all that stuff through the book for Health Sharing Ministries. They can also, because in chapter 6 of my book, I talk about the solutions. I don't want to just complain about how the government ruined healthcare. I want the solutions. And one of the
Right.
solutions is, first of all, take charge of your own health. The best health
Yeah.
insurance we have is not some policy we can buy. I mean, seriously,
Right.
it's how we take
Right.
care of ourselves. We were talking about it with
Yeah.
exercise. We didn't talk about diet, but of course, you know those things. Um, and then the other things is shop for your health care. So when you
Right.
go into a place and if they don't know what something costs, walk out. You would never buy a car without knowing what the price is. You would never stay at a hotel without knowing their price is. Do not go to a doctor, to a hospital without knowing what the price is. Go somewhere else. And
Right.
when you use providers that are cash only and they don't have insurance, you ask them, what's the charge for this going to be? Oh, that's $79.99. I mean, they know right away. Just like our pharmacy, we don't bill insurance. We know prices right away. It's transparent
Right.
and there's no surprises. You don't get any surprise bills in the mail. That's one of the problems with insurance is you don't get transparency and you get surprises.
How do people find those kind of doctors?
Um, there is a website called DPC. Just you know what? Go into any local area that you're in and Google DPC, Direct Primary Care Doctor, DPC doctor, and Londa, I can refer you to. There's not a direct primary care exactly down in Tri-Cities, but they don't
Yeah.
call it
Yeah,
that.
I
But I
know.
could refer you to somebody. Yeah.
Okay.
Um, and yeah, so anyway, so this has been great, Londa. We got one more comment we want to stream. I think Jennifer made another comment, and I got to get close for this. Jennifer, I am 39 with a hysterectomy as of 5 months ago. I am not sure which hormones I need to be aware of now. Which areas should I be aware of? Well, that's a very broad question, Jennifer. Thank you for asking. Chances are, if you've had a complete hysterectomy, then you have no hormones left. So you're going to need testosterone, progesterone, and estrogen. At 39, they might have let you keep your ovaries. Your ovaries may or may not be working. That's a more specific question, Jennifer, that I would need more information. If you would message me on Facebook, Jennifer, go to my personal page, Shawn Needham, and message me, and we can start a conversation. Would probably be the best, Jennifer. Thank you for your comment. And Londa, as we wind this podcast up, I want you to tell me what your passion is.
Oh, well, growth and contribution.
Awesome. That's good.
So, yeah, I don't feel like I'm living unless I'm learning and
Yeah.
sharing what I learn with others.
That's awesome. I wanted to add, you talked a few paragraphs back about, menopause and people getting it, learning about earlier and stuff. And here's one of the things that I like to, and Janet and I, this is what we do all day long, is talk to people about hormones. And a lot of them in their 50s like us. And you know what? You're talking about jumping around on the rocks when you're 52 years old, 52 or 53. I can't remember how old you were. Um,
53, yeah.
yeah, 53. I mean, you do not have to be in a walker when you're 53. Life is not over. One of the
Right.
things that's important is that 50 is young. Seriously,
Yeah.
I mean, 50 is very young. 60 is young.
Yeah.
70 is
Yeah.
young. We have patients in their 70s. Actually, I think she's 80 now. She teaches jazzercise up to 6 times a day.
I love that.
Incredible. Now, but she keeps herself healthy. Diet, exercise, sleep. Hormones are a piece of the puzzle. And one of the things is, maybe you can attest to this. When we get into our 50s, we're in a spot in our life that we haven't been for 50 years. We've worked for many, many years to raise our children,
Mhm.
to build a
Mhm.
business. Now our children are out of the house. We're more financially stable, usually.
Mhm.
The last thing we want to do is be sick. We
Right.
want to live these last many years, with vitality.
Right. Yeah, for sure. I mean, the first half was great. I'm ready for the second half. I'm looking
Right.
forward to it. I'm loving it. You kind of start to pay the price for the way that you lived in the first half in some ways. And so you've got to educate yourself. That's the thing. I think the one message that I want to really drive home to people is you don't have to live with whatever discomfort or illness or whatever that you're living with. Don't just sit back and go, "Oh, well, this is just how it is now." That's just we don't need to do that
No.
anymore. I mean, if nothing else, Google is free. There's no reason to not educate ourselves. I mean, we have access to more information today than anyone else in the history of the world. Yet we tend to be the least educated people about things. If something's bothering you, find a solution, seek it out. If you don't know how, ask somebody. And for heaven's sake, share your resources with people. I get to now tell people more about you because I've gotten to know you a little bit more. I hope you tell more people about me. I mean, we're all just here trying to live the best, most incredible, vivacious life we can. And for women in your 50s, I recently heard a woman say, when you're in your 50s, you discover your relevance in the world as a woman. And I have to agree. It's a really cool time of life, and you kind of, I mean, everything is different now, but I feel like I've got the whole world in front of me. It's just the most incredible thing. It's such a great time to be alive.
Absolutely. I'll agree with you, and I'll speak for Janet too. I mean, we're living the best times of our lives,
Yeah.
and physically too. We're in the best shape of our lives too, so it's possible. So, Julie, go ahead and stream Londa's Facebook. If people want to get a hold of you, Londa, is this a good way?
Yeah, sure. I mean, there's not a lot of Londas in the world, so I'm pretty easy to
That's right.
find. My phone number's everywhere because I'm a realtor, so I am really easy to get in touch with. The Facebook group is Midlife and Menopause if you're interested in that. But yeah, that's an easy way to get in touch with me, Londa Sherwood-Austin, on any platform.
Awesome. Londa, you've definitely helped us realize our goal today, which is to educate and empower individuals to take charge of their own health. So, thank you so much for doing that.
Thank you for having me. What a pleasure.
You're welcome. All right, let's stay in touch. And listeners and viewers, thanks for tuning in to Health Solutions with Shawn and Janet Needham. Tune into our midweek podcast Thursday, 8 a.m. to 9 a.m. Pacific Standard Time. Thank you for listening.